Since and sprite. Okay, so our next session is the environmental health partners resources panel discussion. Brief about that is, so knowing who to contact and the role they play when there's an environmental health emergency is key. This environmental health partner resource panel discussion brings together tribal, federal, state, and local partners for all of the national areas to address the environmental health needs of tribal communities in this region. This panel discussion will give members of tribal communities opportunity to know who to contact when they're experiencing environmental health issues and emergencies, network and build relationships with those partners, and ask questions to find solutions for their environmental needs. Those on the panel today, once I call Dr. Will Berman. Dr. Berman is an environmental health scientist with the Agency for Toxic Substances and Disease Registry. Dr. Berman is the agency for land use and has coordinated the ATSR land use health program for over 50 years. This program integrates public health, environmental justice, and development from the early planning stages. Dr. Berman holds a PhD and Master of Science degrees in Environmental and Occupational Sciences from the University of Illinois at Chicago School of Health that focus on industrial hygiene and toxicology. Ms. Tina Davis works for the United States Environmental Protection Agency as the Commission 5, which serves the states of Minnesota, Wisconsin, Illinois, Indiana, Michigan, and Ohio. She currently serves in the Office of Regional Administration as a 5 Environmental Justice, Tribes, and Indigenous Peoples Advisors, and as the tribal liaison for tribal governments located within the state of Wisconsin. Ms. Tina is also a tribal citizen of the North Pole Rancheria of Ghana and Apologies. Skill is the director of the Wisconsin Department of Health Tribal Affairs Office. Ms. Gail, who is a member of the Nomi Nation, works with her team to administer health services to tribes and educate communities within the Department of Health Services about different tribal communities to ensure the services are culturally appropriate. The office works in partnership with Wisconsin's 11 federally recognized tribes, the Great Lakes Intertribal Council, and the Joe L. Mass Indian Health Center to aid tribal. And then Karen Prescott is the director of the Office of American Indian Health. Mr. Prescott is an enrolled member of the Overseas State Community to receive his associate's degree in nursing from St. Mary's Campus College of St. Catherine, Kansas. His bachelor's degree in nursing and Master's of Science in Nursing and Master of Business Administration from the University of Phoenix, Arizona. He earned his doctorate of nursing master's degree in the nursing executive track from the University of Nevada, Las Vegas. He earned certificates in perioperative nursing, ambulatory surgery, center administration. Resources that find out more about or organizations. So this is going to be an informal conversation with our panel members, and I believe it's someone with your presentations. Okay, let's bring up our first. Our beginning was it is important. Is this on?
All right, great. So I did pull together some slides just because I think it's in an agency in the federal government, you can't know everything that's going on in every program. So for me, it was good to pull something together. So I wanted to thank the United Tribe for hosting us today, and then for NIHB and CDC, HSCR for having me. For BPA, I'm a mother. I'm a tribal citizen. I have a new Wisconsinite. I have a May. These are actually my kids. So I have another Albie, who is 8, and Lucy, who is 11. Go to the next slide. EPA's mission, in case you're not aware, is to protect human health and the environment. So I worked 3 years during COVID at home, so my daughter picked up on some of the lingo. Now she uses this term, a little bit of column A, a little bit of column B. So that's our mission. Like, we have 2 parts, protecting human health and the environment. And that includes the most vulnerable members of our society, like people who are disproportionately impacted, the elderly, and children. So a lot of this is going to focus on kids. Go to the next slide. I'm just going to orient you a little bit to the EPA regions. So there's our map. We have our headquarters office. Many of the slides today can be used as a resource, so don't feel like you have to jot everything down. I can email you a copy afterward, and I'll have my email on the last slide. But I'm out of the Region 5 office, and each office has someone like me. So there's a version of me in every region. We all work with strengthening community capacity, conducting trainings, providing grants, and conducting outreach and coordination among and between workers at the federal level, tribal government level, state and local governments, and then we also work with nonprofit or NGOs. Okay. Next slide. So how do we promote environmental health at the EPA? We go about in 5 action areas: so policy and regulation, through research, building partnerships, and in our community-based programs, and through capacity building and communication. So I'm going to run quickly through a lot of information. Like I said at the onset, this slide deck will be available as a resource, so don't feel like you have to jump everything down. But if something catches your interest, I've included web links on most of the slides, so you can get it, just click through. All right, so some of our most recent program partnerships include an interagency agreement with Indian Health Service, which are colleagues from Indian Health Service are back in the room today, but we have a Healthy Homes initiative under that interagency agreement where we provide funds under our Children's Health, Lead, and Pesticide program for Indian Health Service to provide that technical expertise to tribal governments. And then we've also established, most recently, like last week, we finalized Housing and Urban Development and EPA partnership for what we're calling an early warning system. So we want to make sure that if EPA has been notified that, say, there's lead, high levels of lead coming out of tap water in a housing unit that is managed by HUD, that we are communicating as agencies involved in the process, so that later on we can provide that community outreach and education together. Next slide. So one of the big online resources that EPA offers is that we manage the EJ screen, and it's designed to provide nationally consistent environmental justice screening and mapping. And it combines environmental and demographic data to highlight areas where vulnerable populations may be disproportionately impacted by pollution and other environmental stressors. Our team's always available to demonstrate this tool if your community is interested in sort of running your, what we call our EJ screening report. We can certainly walk you through the process. And what I like to do with tribal governments, because the EJ screen is very centered in the block system of mapping, you don't get a lot of data out in rurally located areas. We like to run that screen with you and verify what data gaps are missing in our data. Okay. So we've got the, so over the years, the EPA has regularly pulled together this report. It's called America's Children and the Environment, or the ACE report. Is something you may have heard. It's been published back in, starting back in December 2000. The latest report came back out in May of last year, but it provides compiled national scale data from not only our agency, but CDC, HUD, USDA, and the National Climate Data Center. And go to the next. So I love playing with interactive tools online. And this is one that I really enjoyed because it also has pictures. But this is our interactive tour of for indoor air quality. So people can go online, look at a map of a home and click on any of the rooms in the home, and it'll share information on key pollutants in that room and how to address them. So in this example, like you see the kitchen, there's a possibility of pesticides or volatile organic things like that. Go ahead. The next. We do have a version for schools, which I'm really excited to share that we now have. So this has been a long-standing tool for indoor air quality assessment at schools, but recently have come into the new age of technology and have a mobile app that includes all of the toolkit resources that are usually on the website and on the mobile version. And again, we're available to walk people through using that app, but it really takes you through how to conduct a walkthrough assessment, how to use the app, and it's focused on schools, but it has a lot of good information for any type of facilities. Continuing on with schools, we go to the next slide. So two of our favorite programs, most popular voluntary programs, includes our idle-free schools toolkit, and that includes templates like you see up there, like put out to make signs, put out the parking lot, as well as templates for like postcards or letters to school from the school board or from the principal to share about the program to getting it started at the school. Then also a little known program, but we do have a physical flag set available to tribes and other organizations who want to have a flag program where you hang up a color-coded flag at the school flagpole every day, indicating the type of air quality. And so people just driving by and can see like, oh, it's a purple air day, I should find outside. And that helps perpetuate the conversation internally at the school to say, maybe we shouldn't have it outside today. So that's a great program, and that's under our airnow.gov. Go on there right now and just type in the quality it says today. So it's really great real-time source, and it's sourced from air monitors, including travel monitors to buy into the program. Let's go to the next. All right, so moving a little bit from air to water, specifically lead in drinking water, we have established the 3 T's program, which stands for training, testing, and taking action. And this program is supported through the WIN program, so you might have heard of the Water Infrastructure Improvements for the Nations Act, or WIN. And it includes resources for conducting 3 T's in child care facilities. And got a lot of resources in it, as well as like in box sheets. Okay. All right, so we've talked a lot about our technical support, but I did want to cover some of our major grant programs that they've seen a bump up. So let's go there next. So this is a new program only in its title and in its amount of funding, but we used to have something called the State Tribal Assistance Program under the Environmental Justice Program, and now we've changed it to this snazzy title, Environmental Justice, Government to Government. And it was newly established under the Inflation Reduction Act and made available $20 million to tribal governments for seeking to address historic, current, and future environmental and public health challenges. And the first round of recipients are actually going to be announced this fall. So we're really excited about that. They're $1 million grants for 3-year project periods. The only pitch I would point out here is that under this program, because of the Inflation Reduction Act money, there was a required partnership between tribal governments and a community-based organization, and that was just because wanted to ensure that the issues that were going to be addressed were real issues. So, wanted a community-based organization. So next. Speaking of community-based organizations, our EJ Collaborative Problem Solving Grant Program is one that's been around for a really long time, but received a much needed, long anticipated bump under the Inflation Reduction Act. So the grant program is open to community-based nonprofit organizations and supports building collaborative partnerships to develop solutions to environmental and public health issues. And it's important to note the language, it's at the community level. So tribes as governments aren't eligible to directly apply for this funding, but can be identified as one of the collaborative partners. And grants here range from $150,000 to $500,000, depending on the size of the organization. Okay. Now we're going to get into some contacts that I wanted to make sure that you had. And this is one of my favorite programs of EPA that I only learned about a few years ago. But our pediatric environmental health specialty units are housed around the country. There's one for each region. Go to this website. National one out there. But here I knew there are folks that are going to be from Region 4 and Region 5. So those two on there. If you Google PASU EPA, it'll bring up the national website and your regional PASU contract. But this is a network of national experts, and they really are experts in prevention, diagnosis, management, and treatment of health issues that arise from environmental exposures from preconception through adolescence. And they provide websites and what we call a warning line, because they're not like waiting up the phone for a call, but their standard is like 24 hours to get back to you. And people from the public can call this phone number if they have questions, and they act as liaisons, providing consultation, education, and then referrals as well. On to the next. Here's just some more Region 5 contacts, but like I said, for myself, if there's someone like this, and I said, okay, so we have a children's health coordinator in every region, we have an environmental justice office that seems to be growing by the day, and healthy schools. So these are the folks specifically for Region 5. If we want to go to the next. That's me, and then I did note for Region 4, but again, there's somebody like me in every region. There's another Katie too for Region 4, for if you want to get a hold of us. Then we'll provide a copy of the presentation. So thanks for your time. I think I covered everything, but I'm sure
All right, I'm Shay. Good day, everybody. Garen Prescott, I'm the Director of the Office of American Indian Health for Minnesota Department of Health. I'm fairly new to my role, so I apologize for the presentation as well as the headline. But as a state, we work, as an office, we work with our 11 tribes in Minnesota and also some other Indian organizations. So within those 11 tribes, we do a variety of things. We have that we administer. We work with 10 of the 11 tribes. So we have one that eventually needed to take grants, so we don't work with them. Should we're a partner. We work on policy and research opportunities. We advocate, and we connect. So in Department of Health, we have covers. We think of NASL's higher needs, physiologic needs, safety needs. And fun fact, NASL actually created that hierarchy based on the patient that he studied. It's something to think about. So we partner with this environmental department. These issues. Example, just earlier last week, one of the tribes has a health director position vacant, and that's usually who our contact privileges from our office, so we respect that nation to state relationship. So what we do then is we contact the health director of the commission. Yes. So there was a case of Legionnaire's disease that I think that state hotel used to have to be time. But nevertheless, they needed to connect with somebody from the tribe, or they were going to go directly to IHS, the field secretary. And which IHS, I worked as a tribe director in clinic CEO for a long time. So Joe Statinsky is a registered sanitarian, great guy. But what I did is really encourage this department of infectious disease contact the tribe, build that relationship, and then offer to contact Joe if they feel beneficial, and got some positive feedback from them as well as a tribe. So it wasn't a work. We work collaborating and connecting with tribes. We have a quarterly tribal directors meeting, which is this Thursday. So we'll be heading back to for that. And then we bring a lot of this information to the tribes. We will invite from and that was some regional partners as well. I didn't mention this, but I'm also a member of the Great Tribal Health Board, which is regional over Indian communities sponsored as a tribal. So really working as a region to develop these some of the successful ones that we've seen. And most of us know that for Indian Health Service, our region is the most underfunded of any area in the U.S. And there's some reasons for that. I think one of them, our region was the last one created, and it was sort of an afterthought. So some of the, when you break it down to how money is allocated, some of those changes are because of that from 40-some years ago, I think. So anyways, it's been that way for some time. So we're hoping to get better data and advocate for our region. And our region is Minnesota, Wisconsin, Michigan, Northern Indiana, and then also the Chicago Indian tribes. I don't want to say it for in Minnesota, that's in my short time that we're working on. We're working on a wastewater testing for COVID-19, RSV, and as well as influenza A. And we just met with our first tribe last week. We've put together a data sharing that's with the state's attorneys now. And the advantage of this is for those in COVID testing, much of the testing now is over the counter. It's not reported to states, so we don't really get an accurate. And we really want to know necessarily our tribal casinos, but we want to know our tribal what's happening. And this is one way that. So, for instance, if we see a rise in uptick in COVID-19, we encourage others to do a little less together activity, if you will, constantly masking, just some different options for people. And as a previous clinic CEO, the RSV really concerns me because RSV, there's really not a for it. It's based on your symptoms and severity. So when one person has RSV, we've conditioned ourselves to run an instance that is very expensive. So we can then get education. So our environmental piece, again, it's very much a partnership. Tribal offices such as where I was for 9.5 years, we have an office of environment, and I believe all of them are tribes doing so oftentimes their contact is very to the state. And all 11 tribes work at different state, some very little, some very I don't know the ins and outs of all of them, but I can speak to with their state, they licensed our pharmacy because of the time they service did not suspect that. Yeah. State and have every experience from surveys yearly, and it seems The other thing we work with the state is some of the fish advisories and things like that. Is we're right. Recommendations, fish letters. Even something like this weekend, the casino weather is hosting. It's the first tattoo convention. I guess it's a big auditorium full of people doing tattoos. We work with the state actually on doing that survey to make sure that's so contacting us at the state. So again, very new. Much of our contact is via email. However, I am, as the director, getting a cell phone to carry for our physical therapy, because sometimes email is not the best for a tribe, and other tribes are. So the email is help at OAIH, Office of American State, and then US, and then my email. You can certainly contact me. It's DARIN.Prescott. State.US. See, I think I'll stop there because I want to make sure everybody's listening. And also, thank you. Environmental health is also a bit of an orientation for me. So, learning as well.
So thank you. I had the pleasure of working in Minnesota Department of Rural Urban with ATSL, and they were one of our leaders in land reuse. So at some point, if you Google brownfields plus public health, you go still probably to this day. There's two places. You end up on the ATSDR National Land Reuse Health Program website or Minnesota's website. We used to creatively gather forage back for year-end funding for different programs, and we were able to compete that out and had several rounds, several years of funding. Several across the country, and we had really successful programs partnering with our states. One thing that we states often have it's in my presentation. We use that to screen for metals. And one of my first projects at ATSDR was in Beverly, Wisconsin, 42 miles northwest of Madison. And Henry Nelson was the toxicologist in the tropics. He liked to call himself. Nonetheless, loved to fish. We create fun videos for our YouTube. So him reading a fishing magazine or at the ready to go to public health assessment at the lonely prepared person in the whole base and have his fly fishing vest on. So one of my first experiences new to ATS was going to there and seeing kind of a community site, and Henry really excited to the fluorescence machine because they were sort of healing propane tanks. So that was an operational facility. So I work on land reuse. So we work on active and inactive sites that could be contaminated. And Henry ran around with the XRF, shooting for lead to see if there was lead-based paint, feeling off of the tanks. So that became one of our programs in land reuse. We have several, and I'm housed within science and prevention section. Because all of our involves working with the public, working with communities, boots on the ground. It's the most rewarding work I've ever done. Very reminiscent of where I started, which was working with environmental groups concerned about water quality in the Great Lakes Basin, working for an organization. So I've been able to keep circling back to this throughout going to graduate school and then working for ATSDR. We started a couple of programs in our brownfields land to be potentially contaminated, but in our sites that could be reused, and one of the primary contaminants of concern by these sites is lead. Lead is a metal, it's in the Earth's crust. And we have natural economic levels of lead. The arsenic is times, and that's north of Gallup is slightly elevated levels of arsenic naturally. So we began a program that at that time was called Soil Kitchen, which is tree office, and that name belonged to somebody else. So we had a soil shop, and then the soil screening health outreach and partnerships. To get there, I think I guess I love to have a wizard. We have a wizard. So wizard. If you're able to Google, I can show you. I did it on my phone. I Googled ATSDR. Apple, Tom, Sam, David, Rita. Not the SD department. ATSDR. ATSDR plus soil, and you've already get in there. So it's, the reason I'm excited about that is very simply and the phones work. So we were using our toxicological profiles at the Tribal Environment Forum this week, pulling up, job stopping amounts of chemicals, including lead. So this is how you get to our soil shop page. My project starting in September is to update this page. Soil shop has come back home to the land use program. We lost it for a little bit. Daycare siting, which is in safer places, and soil shop came from land use and are back in use. So we create a lot of community friendly material. We typically partner with, we're a small agency. So we own 2 X-ray fluorescence machines. They look like little dust busters. They're also used in pawn shops. Does anybody know why? I'll repeat if you have an answer. Somebody said checking gold, correct. I'm so excited taking students on a tour of Men's Hotel in Chicago, South of this. So they could talk to residents about cycling in and out of homelessness and being on the house. And here's an extra lessons number of symbol of course I test platinum, I can test gold. And I think people wear titanium rings now, if I'm not mistaken. There's 2 levels of equipment. Some we just calibrate for lead, but our 2 can test for other metals. And then we do ship them to state and regional offices, and then we beg. We're really good at begging. We're really good at saying, no, that has an XRF. So we partner with EPA Region 5. You saw the Children's Health Program was cool. Dr. Latria Pronto, who's sitting in the back waving at, she just we've done a couple of soil shots together, and we borrowed from EPA. I think some of our state health departments also have experts. So don't be afraid to beg. Ain't too shy to beg. Let's see what resources are we have. And it's all about partnerships, soil health, right? That's right. So on our website, we have materials of how to do a soil shop. We have, it's all there. That is, I don't know if you can find it, it's buried in there, but it's a nondescript image of a figure digging in soil and stuff like that. So this year, it's not posted yet, but I had the English all stripped out. I had one side reprinted in English and one side reprinted in Spanish, and then we have a blank so that it could be internet, for example. And that's what we did for our soil shop also, because it's PDF, and if you have paint or draw or you can customize it. So now we can customize it with some traditional designs. We do, I think our Regency does 2 soil shops per year. If they're in Chicago, we can do more. And this is one of our most effective programs. We can go into that very concerned that want to garden and they're worried about their soil. So I thought I'd talk to you about a couple of success stories that we have. One of my first soil shop events was in Blue Island. It's a collar suburb of Chicago. And I did what I thought was my home. I live in Chicago. I have a friend who lives. And I just started working with the city government on a brownfields grant to make the community health portion of their. I get very interested in that. I asked, the then all-white city government, tell me about the community. Oh, we have some people of color, primary Hispanic, Black, or African American. I looked at the census data. The census data we expect then was 10 now, I think it was. I mean, it said the community was 22 to 25% Hispanic. So we go to the soil shop and brought the pediatric environmental health specialty and folks from region and a couple other people. And we did blood lead screening and we did soil sampling. It's very effective to combat this. And the census data was up to date. The community was now 50% Spanish speaking. So fortunately, we partnered with a local hospital and Florence that did finger sticks. Blood lens was fluent, bilingual, native Spanish speaker. So never again thought that ever happened in my life. Like, are you sure? I was saying, are you sure? And the best for us is to work with something to the translation. So we do have Spanish materials. Hopefully we'll have in the future materials. For example, this region, and have to be able to be tailored. And then it sounds small, but it's a big win for us. We were able to buy all of our regions, soil shop banners, materials, generally print materials, had translation of our video about soil shops so that the transcripts cease. Closed captioning will be in Spanish while we're speaking English. We did soil shops, and going back, we had Island, we had a cartoon in Barbara, Dr. C, Dr. We have students a lot, so Dr. C, Andrea, and I were able to partner in 2019 on 9/11 in Benton Harbor, Michigan during I think it's a Saturday farmers market. I think it was Saturday. And what you have, so we and then and Benton Harbor, Michigan is across the lake from us. At this point, it's like Michigan, about 80 miles from Chicago. And they made national news for a lead type water crisis. Same thing going on. We just replaced our risers. The water risers in the highways were pipes built in the 1960s are now failing. Small communities, I always talk but it's not always needed. So, and the expert just popped up and said, no. So that was really interesting for me. Anti-corrosives are needed if you have an agent water that will cause that to challenge. So when you look at the insect doing I was curious. It's got this disgusting goop, this hardened scale. That is a good. That is what binds that. And usually it's phosphorus that binds the lead or phosphate containing material. So there's even needs out. That if you're really worried about the pain, paint this and it'll bind that the safely still test for lead, but it can be because it's bad. It's chemically bonded. So we go to that farm in 2016. The city began to notice that things were failing. At that point, they were monitoring blood levels, and they were not alarmed. But the water was approaching the action, which I think had was 15 parts per million. 15 parts of lead, billion parts of in soil, it's direct exposure to soil, different exposure, I should say. It's typically 250 to 400 parts per million. So we come to that farm and say, we're going to do a soil shelter in farmers. And we partner with Andrews University, which is in Berrien Springs, Michigan, also the local health provider. So these can be pretty creative partnerships. Which partnerships. We were the health department that was a little bit nervous that we were coming into this training. Now everybody knows about the problem with the water, and everybody's on the filters. Okay, health department has distributed filters. When we learned from Flint, Michigan, if you have high amounts of lead, filters may fail. You got to change the flush one. So we replaced our risers with big pipes that bring the water to feed our equipments, but we haven't replaced the personal risers yet. So I don't get stuck to water. It's as trust, we have to replace that piece of it. So the apartment is like the lead line that ties you to the water main, and then our risers are like. So we come into the community, and the health department said, sure, this is a good idea. You have to have downtown. And we had students from Andrews University that really loved getting soil samples. One person brought in a house nest, worried about it. So processed 80 samples, and Dr. C could correct me if I'm wrong. I believe that none were above actual levels. This is during a water crisis. So what did we do in March? We decided to go back to Bemidji. Now we're back in Bemidji because I'm invited by the city commissioner. He owed speaking text communication and was on national television. Our people did not know what a key read is. Said, oh, we have an upset community. We have an outreach team. National Association. I said, would it help if we gave a 4-hour communication environmental health risks training? Because the city commissioner said we need our capacity though. I need to educate my folks on how we measure contamination. So I said, perfect. We tailored our training to focus on lead. The training is designed to be tailored to levels. So we were teaching some of the tools like just a screening tool that are BJ index, which can work with the census tract levels. It's overlaid with sodium vulnerability and BJ indicators are the. So we work with NEHA, National Environmental Health Association. Was the ATS terror person with 3 NEHA trainers and piloting this training. And Sharon Bunker is my partner. Both said, I'm a little nervous about this. This is a really upset person we have on the phone and in Zoom who's very upset and very concerned. And said, we all need to watch television, video, and get the voice of the community. So we also decided to focus on the positive because what happened in Michigan is the government started to promote the legislation came through for Michigan Department of Health and Human Services to do whole home lead assessments for free and fix the problem. So people were getting $20,000. So we said, okay, now we have a financial straight. Day one, which I believe was Friday, right? We always do things like that. I think it was Friday, at the Boys and Girls Club in the afternoon, so that we're good at the town. We did the training on communicating environmental health risks. We included these tools, EJ screening, for example. We had the other part of the outreach was, why does all the money that comes here go to the county and it's not for city? So we brought this state nonprofit person in and we said, well, we're looking at federal websites. Look at your Michigan website. I've got 40 projects going on. And we then did a demonstration of that. We had conversations about that. And we did all of our message mapping of that. And we were able to say 99% of the lead pipes have been replaced. That's 6,000 lead pipes. If you're still concerned about it, the county is here and they still distribute water filters. There's been 2 rounds of water testing. They're both below the action. So then we played the video clip in the city commissioner in the room. And then we showed a video that was filmed in the Boys and Girls Club about what a great place that Harvard is to live. And we then did a soil shop the next day. So the first time we did the soil shop, we had 80 samples. This time we also had the blood level data summarized, with the caveat that about half of our kids are being tested. But levels from the whole period of time and actually dropped from 2013 a little bit in children. And so we didn't see an evident elevation in blood lead levels in children, but we didn't see all the children being tested and which children were tested. So was it a equity sample? Was it kids whose parents could go to the doctor, or was it a so in Benton Harbor, this was our second round of testing, and we had communication of risks first. Second day, we had the county health department there giving out radon test kits and water filters and pictures, I believe. And then we had the people that signed you up for your whole home lead assessment. So we really good people signed up. And then once again, other than a glitch with the first sample that was like 0's2. When Dr. Project went over and said, you know what we need to do now. And so this is going to be an emergency. Well, they shot the sample with that. Maybe it was one of the first samples, but you do 3 averages, 3 samples with the X when it was elevated. So that was really successful. And then last summer we did a soil shop in application in Mexico, Red Lake chapter. There's 110 chapters, it is 4 activities. And we had samples from the community from a site that has a soup pot full of contamination, which you'll learn more about in the presentation. They were finding dioxin, mercury, volatile organic compounds, hexavalent chromium, which is bad, smoking can cause cancer. Really, just a soup of different chemicals, benzene, naphthalene, the contaminants associated with petroleum. And was naphthalene case said, I'm really worried about that water tower because that thing is decades old and it's not peeling. So she put samples around the legs of the water tower. It did not have lead. And none of our samples had any kind of alarming for lead. Some of the arsenic was elevated as we would expect, it's naturally occurring. And it turns out the water tank was taking and has other issues. So it's a little bit about soil shop. Something to consider. This region could be the next soil shop trip, region 5, maybe. Take 3 hours away. Have it survive travel. did a large number of soil shots across the birthday last year, this past year. So great to do more every year, either at that time, even to consider before and after testing. So the kids get out of school in May, they might outside all summer, it's kind of fun sometimes to see a big strict exposure by testing soil testing kids. Information by LA. My real email is at JQ0, which really is just Frank Joseph Queen 0. But LA Berman at cpc.gov. On my land use website, I think probably in person and it should be in this conference materials. If you're reading my mind, let's see what's together. Now, let's give it a minute. And what I want to do is I have a really presentation. Doesn't have any questions. It is not, I guess. My suggestion some of the tribal programs to put in acreage have their own XRFs.
Yeah, there's, the tribal programs I just have some, institutional. Sometimes they will use an XRF. It's a bigger program because there's a lot of but there are some other than you.
Bemidji has one. Thank you.
Well, yeah, Barry, you go right in the district. So the city, yes, we do have an XRF measure metals also, and we have done studies similar to what you're doing this time. At one time, that was used as a gun range, running a test for lead, and what the work that they had done previously had actually worked, and we didn't find any lead, so that land was reclaimed, used for a community center. So we do have that capability in the area, so keep us in mind. If you have any projects up here, join in on it.
That would be great.
Good morning. Thank you again for your presentation up there. Just a really quick question. Is there a kit that rural individual households could use to test soil? Or, I'm thinking about now, getting back to now, thinking about my kids right now. They go to school at Winter Rock High School, middle school, and the primary learning center. They have the fountain drinks and water for the kids that don't have a lot of water to take every day, utilizing the water from the facility there, and that's downstream from now. So it's sort of like a little test kit, and then you look at like how rural Native American communities are. It's sort of like a little kit that people could utilize for testing their soil, or people want to buy land off reservation. We're surrounded by peanut. The old line right there in the Black Hat area. I see some of that land for sale right now. And is it viable? And how can we get those simple test kits possible?
So one thing I would suggest, so I'm really good at ferreting out who's got what. So Navajo EPA, Maples is with the Superfund program. I don't know if they have purchased an XRF. But I do know, here's the documents that they just awarded $10 million from 128. And so perhaps some of that could be used for it's probably by chapter. However, there's a lot of collegiality. It runs not that far. So that is one thing, is to see if your tribal environmental agency has access. Some of your universities also will, and your state departments. You could potentially get, I don't know how big our program yet, but during COVID, we did drop off soil shop. Should have brought that up as a case study. Bags of soil, and then one person ran the XRF, and it could be possible, like email me, and then I could see if that one of our regions uses Ziploc bags, and then I know that some of the big box type stores in the big box there are soil wipes, and you can write like a painted object. I don't know how well they would work with lead wipes. I don't know if you could rub a pile of dirt, but maybe that would work. I know you can rub painted furniture, and lead is red, is the marker for those wipes, and I think that's $10. And I know less water test kits. They use a water sure. No, they should taste for the person because of the age of pipes. So I know less.
Let's just suggest reconnection water in schools. Great Lakes Tribal Peace Center, I know, has they're doing testing with schools for that very thing. That's very just
In Minnesota, there's a tribe that is working with, so it depends if the school is a pyramid education school. UK has been partnering with the tribe that have been testing, and they gave a high PFAS, and now we're all in school. So pyramid education can bring resources to the table. Very well.
There's a lot of guidance.
Question along the same lines. Before I ask this question, let me ask, do we have any questions on the? So no questions online. Thank you, Rhea. For those communities where you go in and do soil testing, so a soil shop, and you do find lead in the soil, what is the process for cleaning up the soil? And how long does it take before the communities can start planting their gardens again? Okay, so in my experience, we have not found in the soil shops that I've attended, not found very high levels. If you have really high levels, then that could be an emergency response. And there are agencies such as EPA that you can reach out to. If you are concerned about, if you have slightly elevated levels, what we would recommend is a whole bunch of clean soil on top of it, like a lot, and or to container gardens, or build, you can build your own. I have a community farm, it's just wood screwed together. We, in our soil shop materials, we recommend, any concerns at all, you can, plant on top of asphalt if you contain it. And on maybe 2 garden plots, one on targeting the other one is on our company, and I have black, very inexpensive cloth bags, and I'm on year 2. and I filled them with soil and put some mushroom compost in there. And, oh, I mean, well, we don't get a lot, a small little balcony, but I have basil, thyme, lots of tomatoes, and we feel pretty comfortable. That clean soil and that mushroom compost. So you can grow, growing power is it might be national. We should probably start in Milwaukee. Will Allen, basketball player, started growing power. Erica Allen, Stoner, is now doing growing power in Chicago, in the inner city, heavy traffic neighborhood. So we're expecting, maybe there's still lead on the ground from petroleum from years ago, because it's metal, it doesn't go away. I still have looking. So Erica says, asphalt is my friend. Parking lots are your friend. And you can do vertical gardening, and it can give huge crop yields growing in bags and going up, creating a vertical space. So you can use the soil now. It is extremely healthy, and it's been redeveloped. Sometimes there'll be like a deed restriction on the property saying you can plant flowers but don't plant vegetables. But you can plant. You can plant it in a 5-gallon bucket. You can plant it in a bag. I use a bag, and tomatoes are delicious this year. So my community plot, my tomatoes are terrible because it's very windy. The one downstairs, but upstairs they're doing pretty good. Because I'm project, but so I'm seeing even up high in the air, getting a couple of butterflies. I also got attractors. So can do it, can be safely done. There's a big community garden that's become community supported agriculture. Land donated or borrowed from engineers. I think the last time I checked, they had 18 community supported customers, and they also have 12 community partners. I believe it's 12, the largest one, and the Park District recreational facility, and they just mounted it. So you can really also make a huge amount and feel fairly confident that you have clean produce.
I don't really have a question. I just wanted to make a comment, particularly in the area of childhood and voicing prevention. So, I want to point out that we have a proposal with here that's going to do a presentation after lunch on lead voicing and discussion. I just want to point out again, sort of focus on how it's very important that we do that kind of screening. Paul will let you know his presentation that no safe blood level has been identified, and so as we're thinking about normal just factor actually do screening. There is I would say correlation with high soil levels or high levels of water and sources. So together, whatever we can do to prevent our children, us as a country, all of us, with the poisoning and from using, but the fact that any exposure to lead could possibly, result in elevated levels of that in our children's blood is very important. So I wanted to say thanks for what you do. Hopefully that we're meeting with various childhood workers in your state. And again, thanks for all to bring that and share some.
Hello again, everybody. I was just curious about the presentation. You can read the new funding opportunities. really intrigued by that because, CDC is just in the process of creating some, you know, to the- what has been your experience, if you have a longer term, something 1 year that going for one just what's the experience like, and what if any, keys to success in that type of partnership? Real life, or
Thanks for that question. You know what we do best in our environmental justice programs are webinars, informational webinars, and then also we build in terms and conditions into all of our grants that get selected to have monthly check-ins and frequent reporting that includes work plan templates. So it really helps nonprofits who might, be having a grant for the first time from a federal agency learn the ropes. And I'm glad you asked that. I feel like it's a plan because I did want to, seeing an NIH here, reminded me I left out a slide for a technical resource. EPA has $10 million per region and 3 national efforts to do environmental justice thriving communities technical assistance centers. And those are purely to provide technical assistance, resources on how to write grants successfully, how to build your organizational structure. If I'm someone who wants to start a nonprofit to address lead in bundles of children, how do I do that? I can call up NIHB and figure that out with them. So I'm really excited that those are being stood up this year, and they're going to be 5 years. So that $10 million is over 5 years, but it's at $2 million a year, with 2 being in our region. Blacks and Green nonprofit out of Chicago and the University of Minnesota are both going to be serving as Region 5 Tic Tacs, but each region has one, and then 3 national ones, including National Indian Health. So we're just trying to, some people are saying, don't give me any more technical assistance, please, you're hurting me with your technical assistance, but we want to keep putting the pedal down with that, because, someone has a great idea in their community on how to help address historic, current, or future, especially around climate change issue, we're ready to help. We actually have the resources from Congress to do that now, so we're really excited.
Thank you. So I just want to follow up on that. So when you talk about providing technical assistance, grant writing, and those types of things, being CDC, I want to make sure that the grant writing is like federal agency and not so specific for one, option versus another, because this is a great opportunity. We're so happy that there's funding, especially for NIHB and others to do this kind of work. But the opportunities come few and far between. So plan as much as possible, make sure that when the training is done, although it might be specific for EPA, that there's an understanding of, what the stance is for everybody. Some general things that go across all federal agencies. I think thank you.
That's a really great point, and I'll just make a note of that. And I thought you have some. Go ahead.
Hey, thank you for the presentation. Hey, this is one question for Gail. Getting back to your slides that you presented, human health, and it was really children based, as you said. There was a slide in there about homes. I didn't get a chance to click on that. Is that something unique that you did in your region? Is that
The Healthy Homes Toolkit?
yes.
Yes, so that's not unique to our region, except for the interagency agreement that we have with Indian Health Service. That is unique to Region 5.
Okay, excellent work. Because I think getting back to that, we have different households. We have the Hogan variation of Hogans, shitty house, skinny shitty house, and then just regular homes. I think that was really creative what you did. Really cool if we could somehow adopt that in Arrow with Region 8, 9, even 6. So I thought it was really neat. So I think I'll be chatting with you to see
I don't know, something here too. So, good job.
Yeah, thanks for sharing that. We have colleagues in Region 8 and I sort of talked to from our end. But the thing I was going to mention about the grant writing is I failed to mention Department of Energy has air quotes brought into our thriving communities technical assistance centers. So there's specific grant programs at DOE that the centers are going to have to promote and help in writing. But we at EPA have not limited grant writing support to EPA funding only. So if an organization brings in any kind of, oh, I have this RFA, can you please help? The tax can do everything but put pen to paper for that organization. They can even review the drafts and provide comments for improvement. So they can sit beside them but not hold them for any grant.
No, I just quickly wanted to mention it, this is sort of reference to what Joanne mentioned as well. Just so everyone will know, and really appreciate EPA and all of what they're bringing to the table. I actually meet with EPA and others across the federal government on a weekly basis. There is this concept of thriving communities network, whereas where all of us across government are trying to make sure that we are communicating. Talk about TikToks as well. EPA has the funding, but just as with subject matter expertise. We have others, Department of Transportation and others. I just want folks to know this is an all of again, and so we're trying to do whatever we can to really sort of address these issues collectively. So just wanted to.
And then just to provide a little more information about HSCR, there are 10 regions. Each of the regions are embedded into communities and work very hand in hand with PA. So whenever there's an environmental health issue or environmental health incident, then HSCR right there in the community as well. I think one of the benefits of being embedded in the community is that we get to know the community and we get to know who to go to, how to work with the community. So we're not just going in one time and then going back to our home office. The community is the home office for HSC. Any other questions? Brett, how are we doing on time? Okay. We have about 10 more minutes, and I think that the next item on the agenda is a networking session. And so before we get to the networking session, I did have one question for for Darren. And I know, Darren, you mentioned during your presentation at the federal government agencies, the non-governmental agencies as well, funding. And you have faced some challenges. So, what are some of the challenges that you face? What are some of the creative ways that you can come up with to face some of those challenges? Because we have to, CDC and HSCR, we have to do the same as well.
So some of the challenges that are kind of federal health are very bad because lower Zuni community we're small. We're fairly small. We're actually both in Dakota communities and also. So I would say one of the things that actually is partnerships being partnerships. CDC, PA, through our state, yes. And then certainly our truck, which is working for the state. That's probably our MS. So I would say official is to and then utilizing regional. We don't have a truck, so we do it by head start. And our office on fire because we actually did pipes. So the community water pipes, the ones that come out of the based 20 years. So and so I'm gonna make next section. So my copper rates are just above. I choose your water now. So yeah, we have dog. We have water. Someday I want. And then the other thing we do is just making sure that we know where our supplies are. Water companies really want to keep track of it takes to make sure that say partnerships.
So I think we will hear more this afternoon. And then some of the ways that we have CDC and HCR so Troy will actually talk about that later this afternoon. So I think before we go to the network session, I just want to ask one more time. Additional questions? The panel member or anyone else in the room? Let's give our presenters and panel members another round. And there is a room, so if anyone wants to meet with panel members one-on-one, if you have additional questions or conversation, feel free to prevail. There is another overflow room next door if you want to a little more